The next meeting, just ratified at the next meeting. Okay. We won't be able to deal with that then, is it? It's an urgent item, but does it need an urgent decision? We'll have to deal with that when we get to it then. Yeah. Okay. Okay. So we've got no urgent business this evening. Thank goodness. No references from other committees and other bodies. And can we have the apologies?
Yes, Chair. Apologies from Councillor T. Salim, Dr. Nina Pearson, Amanda Lewis, Lucy Nicholson, Maud O'Leary, and Robin Porter.
And Sally.
Yeah.
So the first report is the report of the Health Inequalities Board. And I'm not sure who's going to deal with that. Would that normally be Sally? Mark, are you on?
I'm here, Hazel. Yeah, sorry,
Okay, yeah.
I didn't. I'm not sure who's in the chamber actually, but I'm quite happy to take that. It's a short update anyway with regards to health inequalities. So this is one of our three main boards that we have in place now. We actually went back and we had a reset. There was a workshop back in March, which actually set the plan and the tone that you'll find at the back of the document today, setting out the 5 priorities and the work programme that we've been moving forward. This is one of the main driving forces between us, about us actually achieving Marmot Town status as well. So this is all linked together tactically and strategically from that side. We recently had a really positive update from the BLCF and Karen Perkins in the work that we've been doing around the Community Recovery Fund and how that money had been utilised to support those that haven't been able to access vaccinations and support services and dealing with some of those wider inequality issues as well. Is really helping us informing back to the plan and the priorities to give us that roadmap and that sort of check and balance. What I've also agreed to do is take on personally is actually chairing that group now, so taking over from Sally as we move forward, just so we can actually coordinate the 3 groups as well as we possibly can with regards to Children's Trust, health inequalities, and all of the things that we're doing at place as well. So it really is a bit of a scene setting by way of a brief update from us this evening with regards to where we are. But I'm also happy to take any questions if there are any online or any in the chamber. And apologies, I can't be with you this evening. I should have started with that. The train's obviously today, and that's the reason I'm not there tonight.
No, I totally understand. Are there any questions?
Thanks, Ed.
No? Are we happy to agree the report? Thank you very much. We move on to the second report, which is a place board oversight. Kate was supposed to do that. Mark, are you going to do this?
I thought Kate was meant to be picking up as well. She's not with us online tonight.
No, I can't see her.
So again, I mean, for place, we've had some really good sessions and there's some momentum behind this now. So we've started to develop what we mean by healthy neighbourhoods and healthy households, which is really helpful in the context of the work we're doing across the health sector, in particular, sort of the work we're doing with our PCNs. We've developed that into sort of like a broad list of statements that we're talking about now that we can share with the Health and Wellbeing Board at some point. What that does is actually that draws together our work at place and actually how we're going to hold ourselves accountable in that position, and very much, which is very positive. The engagement of the group has been great. A number of the people in the chamber tonight and actually some of the people online have been fantastic in helping us move that forward. So what we're starting to look at now is sort of our mapping assets, how we're mapping services across place, actually how we tie that back to the delivery plan that we've got, that we've shared a number of times up until this point. And what I'm hoping we can do as we move forward is bring back the evidence and the tangible difference that we're making through the delivery plans of what we have now, and how we're looking to join up the wider system as well. And I think there's something really interesting for us in this place as well with regards to data and insight and what we start to understand about the various pressures we've got in the different wards. what work we've actually putting in place and actually how that's going to be different and substantial over time. So I'm really excited about where that'll be over the coming months, and there'll be some really powerful pieces that we'll bring back through the Health and Wellbeing Board. Kate, I've done a bit of a summary, so if there's anything I've missed, by all means, please interrupt and chip in.
Apologies for my late arrival, people. I hope I haven't missed too much.
I've just done a very limited summary in your absence, so about a 2-minute sort of run through the things we've done over the last sort of four weeks, in particular focus on the healthy neighbourhoods and households, how that's informing and sort of the work we're taking forward from that space as well.
So if you want to add anything, Kate, by all means.
Lovely. Well, yes, I can give you a quick run through Ageing Well, if that helps. If people would like to know a little bit more about the successes and the issues that we're facing.
That would be useful, yeah.
Okay, lovely. Okay, so you'll see from the slides, there's a number of slides, it's a heavy presentation, but the data on the latter slides covers Ageing Well, and you'll see that the falls admissions, the emergency admissions for over 65s is relatively stable in Luton now, which is good. We remain similar to the national average, despite the incidence of higher acuity post-COVID. But there's been a recent review across BLMK of the fall services, and in light of that, we've received funding in Luton that's for a single point of access. And this single point of access is based on a therapy model. It's supported by a therapy assessor and will provide strength and balance training in addition to that. So recruitment's currently underway for the assessors, and hopefully the service will be up and running very quickly. They've also been provided with a razor chair, which is a kit that safely lifts patients where appropriate, and an assessment is done on the patient to make sure that it is safe to lift them. We're hoping this will prevent ambulance call-outs and referrals straight into the single point of access for the therapy model to continue. We also hope it will prevent delays in assessment and rehabilitation and bring our numbers down for Luton as well. And it should, in theory, support or prevent further falls. So as well as the fall service, I'd just like to give you a quick update on the urgent 2-hour community response, which is managed by Cambridge Community Service. And the compliance data for that is showing that we're on a steadily improving trajectory. Now, the urgency response for people who haven't managed to read the presentation is a 2-hour response between the hours of 8 and 8, 7 days a week, to people who are not in a position of a life-threatening situation. And on top of that, there's a 2-day reablement home-based offer to support people within their home if it's thought necessary by the multidisciplinary team. Just quickly on dementia. So the dementia data of the over 65s, you'll notice that Luton is higher than the national average. So early diagnosis and effective support is absolutely essential if we're going to keep people safe and lead as fulfilling life as possible post-diagnosis. So what we have done in order to provide a swift response post-diagnosis is to set up a new intensive support service with a range of diagnostic services and support offers post-diagnosis in order to support people going forward. In addition, on the slides is quite a detailed slide on digital projects, and I'm happy to go into more detail at another time, or if people want to contact me on digital and have a chat with me, I can give them a little bit more oversight.
Sorry, apologies, but there's a bit of a coordination aspect here, and I think the right moment to jump in, but we were actually talking about the place board.
Oh, sorry. Sorry.
Hazel, what we've actually done is jump ahead to the update on the population and wellbeing.
That's my fault for coming in late, isn't it?
That's okay. We'll have a more potted version when we get to Ageing Well when we speak about it. So, Hazel, I think from the point of the place board perspective, I've given that update with regards to households and neighbourhoods and the work we've done and the plan and the update and what we'll bring back through. I think that just takes us on to the next item, actually.
Yeah. So if members have got questions on either of the reports, then that's fine. No questions on the place board. Yes, Javid.
So only on social, the staffing around social prescription, it says closed board agenda in September. We won't be having next meeting in September, will we? Because it'll be every other month.
No, place boards every month, Javid. And what we had an item, sort of a meeting before last, where we were talking about the success of social prescription, what we were doing, and when that funding will come to an end potentially. What we've been able to do is make sure that's going to be extended through till March now, predominantly, so that's okay. So it gives us a little bit more headroom with regards to how social prescription is going to work. Kate, I'm not sure if it's on the agenda for September or October.
It's looking like October, I think, for social prescription.
Okay. But Javid, we're happy to talk you through where we are on social prescription and how that's bringing together the wider neighbourhoods as well, if you like, outside of the meeting, or an item we can sort of make a particular reference to as we set it place.
If I can just complement your question with regards to the social prescribing. So in the report, you'll note, and it has been mentioned before, but it's something called the fuller neighbourhood teams, is actually what things are being referred to. And it is purely because there was a nationally commissioned bit of work about next steps for primary care. And when I say primary care, primary medical practices, your GP practices, dentistry, optometry, and community pharmacy. And I think for me, as just reiterating, what's been said, is that the place board is the place, because when we're talking about fuller neighbourhood teams, we're talking about the widest. So the community are fabulous assets, our voluntary sector. So it is not our old traditional multidisciplinary. It's about what makes a difference to people's lives. So again, I think through that place board, what's been said is where the activity takes place. But it really is important that you are cited. I mean, many of us are on there, but you're very cited. Now, and this links back a little bit to the Overview and Scrutiny Committee. We were in this room earlier in the week, and we mentioned, and it needs to be raised, is that access to the health and care service often goes through, most of the time will go through your GP practices. So we're working with that place board. One of the objectives, if you look in the papers, is access to urgent care. And there's a massive area of work of helping our population to understand what the offer is and how they can help us. And social prescribing, as you mentioned, it is one of those big areas. There was a document that came out only last week in helping us to prepare for winter. So we'll hear a little more about this as the months go by. But clearly, social prescribing, health coaching have a really, really important part in this. And the Luton system, if you remember a while back, we talked about services for, we call them high intensity users, people that actually need to be supported. And they're often people with isolation, all sorts of complex issues, which traditionally ended up in a health system, but actually it's everything else. It's trying to do the root cause and helping people to help themselves. So I think increasingly that's where the Health and Wellbeing Board will want that assurance that the right conversations are taking place at place. And I think with Mark, Kate, myself and others, I know Phil's there's a lot of people, it's about the energy of the people in the room to make sure that we're really driving those improvements.
Just to come back on that.
Yeah, just a comment on the Luton Place Board. We spent 90% of the meeting defining and discussing what a healthy household and a healthy neighbourhood were. All good stuff, all important, but if I look at the chart in front of us with the 6 priorities of what the Luton Place Board is trying to drive, it would be helpful, because we don't have time in the board meeting to go through everything, it would be helpful if attached to or following on from that chart that we see on page 28 of the document, what action is actually happening in each of those 6 priorities. So I presume that work is going on in the background, as Nikki has just said, by each of those 6 senior representative officers and the like. It would be really helpful if we could have some feedback on what is actually taking place, what is happening there. Yeah. What is happening and what the outcome is of what is happening, because we can have the strategy, we can have the objectives, we don't have time at the Luton Place to go through everything because there's not enough time to do it. So on this document, if somebody could sort of submit, you know, this is what we're doing, this is the outcome of what we're doing, that would be helpful on a monthly basis, because otherwise we don't hear anything about priority 3, for example, for 3, 4, 5 months down the line.
Is that doable? Yes? Yes, it will be doable. Yeah, okay. So in a future report, we'll include that. Okay. Anything else from anybody? Gilbert, did you want to say anything? No. Yeah.
Yeah, and I just wanted to sort of, I think Mark's answered it, was with social prescription link workers currently working over target beyond this recommended caseload capacity, 3 short-term funded roles coming to an end. Just want to make sure that we're going to be able to make sure that we've got enough strength of people to be able to fulfill and provide the service.
I'm quite happy to answer that one, Hazel, if you want. Yeah, what we've done, Javed, is we've actually gone back and we've reviewed where we are, and we've got enough capacity through to March. What we do need to consider is actually the future of social prescribing after that point as well. But that is the reason we're going back in October to say this is what it looks like, this is the outcomes, this is the benefits adding to the whole system, because I think there's a general consensus, and I know you're in agreement with this, it actually adds an enormous amount of value to the system. So if there's any concerns or issues, we'll bring that back through Health and Wellbeing Board at the next meeting.
Anybody else? Sorry, Kate.
Sorry, Chair. If I could just go back to Phil, just to update Phil on the Place Board programme. So behind the priorities, there is a programme plan which goes into detail on all the work streams that sit underneath the priorities. And we're currently developing a KPI dashboard that's underway. I mean, it's obviously a massive piece of work, so it has taken us some time to pin those down. And the Place Board reports will be a high level across the priorities. A lot of the service directors who are managing those work streams are saying quarterly reports. So that's just to give the board a heads up on that. But there is a detailed programme plan behind which I'm happy to share.
No? Okay, we're happy to agree the report. Thank you. We now move on to the population wellbeing strategy.
Fantastic. I think that's for me to do an introduction, Hazel, and then I'm going to hand over to Shimone, Elizabeth and Kate. Actually, and you've already had a little bit of sneak preview of what we're talking about with Aging Well as well. So that we'll assume that everyone's been through the deck because it is very lengthy by way of the nature of what it is. But what it does set out, and I hope everyone, if they haven't had time to go through it all yet, you can do over the next couple of weeks, is actually really sort of maps the progress. This is the overarching document for the Council and the Health and Wellbeing Board by how we are governing, making a difference and a meaningful difference across Luton. And it's broken into the 3 categories, as we all know. But what's really important here is that we all collectively own this strategy and this document. And what's really important now is that we reflect on, when the team take you through what's gone well, what some of those challenges have been, is how we're thinking about in the context of the refresh that's going to be taking part towards the end of this year. So looking at the strategy, the deliverables, those KPIs that Phil's talking about, how it brings those other 3 boards to life as well, that really got an effective system that's responding to and working to address the inequalities and really move the health and outcomes for the residents of Luton in the right direction. So what we'd welcome today is your input, sort of like comments on what's happened, where you think some of the challenges are, and maybe what the group could do, this board could do collectively to really move the next iteration of the population and wellbeing strategy forward for us. So at that moment, I take my leave and I will pass over to the team.
Okay. Anybody else want to say anything or wait for questions? No? Wait for questions. Okay. Are there questions from members?
So Hazel, I think the team, sorry, I'm just going to hand over to Elizabeth, Shimone and Kate now. So we're going to start him up. Yeah.
Don't know who to go. I can go first. I suppose I'm just starting well. So if we're working on chronology, I can go first because I'm dealing with the children and young people side. So I'm Elizabeth Elliott. I'm a consultant in public health, leading on children and young people. And again, I'm not going to go through the whole presentation because it is very long and very detailed, but I just wanted to give just a couple of minute overview around Starting Well, and just to kind of go through some of those areas where we are kind of wanting to show that we are improving, and some of our successes. And there's quite a lot of detail in the dashboard, but just want to draw your attention to, as I say, we're improving. So we have over the last couple of years when we look at young people in schools and attending schools, the numbers who are ready for school when they start at Key Stage 1, that's maintaining. So we've quite at a rate where we should be, and we're maintaining that. Our children who are reaching their expected standard at KS2 is improving, and we are almost now hitting where we should be. Over the last few years, we've had really good improvement over the last 2-3 years. The number of children who are accessing a good or an outstanding school assessed by Ofsted is also improving, and we are doing well compared to the national and regional average. And one area where we're particularly doing well, there's still work to do, but is our children and young people who are not in education, employment or training, who are over 16, that we have one of the lowest rates of young people in the region. I think we're only about 200, just over 200 young people are in that category. So we are working very hard to reduce that even further, but a particular area where we have, we are doing well and are pushing ourselves and challenging ourselves to develop that even further. When it comes to health, we are number of children who have decayed or missing teeth. Particularly, we're coming from quite a low standard, but in the last survey that was done a few years ago, our rates started to improve. We haven't had the most recent update that we should have in the next year. We're hopeful that we will then continue to improve around our dental decay. Our rates of vaccinations, again, we're starting from a lower base. We are below average, but our numbers around MMR have been increasing. Our numbers of young people who are admitted to hospital as a result of self-harm are low and are reducing, different to the national rates. And we have really good rates of really low rates of smoking at time of delivery in our mums, and our breastfeeding rates are very high. So that really early start, that getting a really good start for young people, our rates are quite good. Our vaccination rates, again, we do need to improve, but they are getting better. I don't want to go through all the data, and I'm not going to go through all the challenges and all the successes, because I'm sure you know a lot of them, but I just wanted to focus on three strategies and 3 pieces of work that we're kind of moving forward on, and you will be hearing a lot more about this in more detail, but just to kind of introduce them. So Marmot Town that Chimame is going to talk about in a second is part of the work where we are really dedicated to moving forward. They're challenging the inequalities that Marmot had picked up around young people achieving their potential and having the best start in life, and that leads really clearly into our Child Friendly Town programme, which we're going to be starting at pace in September, where we will be starting the discovery part of the Child Friendly Town. So that is part of our 2040 ambition, as you all know, but also moving us forward to ensuring that our young people are heard, that they are respected, that they are safe, that they can achieve their potential. And this is a long programme. It starts off with a really strong engagement and co-production aspect. So that is going to be that discovery programme. It's about going out to schools, to youth services, young people, really wherever they are, and talking to young people and getting that engagement process really, really key. At the same time that we're doing that, we're going to be developing our Family Hub programme. And this is another piece of work that's coming on board over the next, starting now. You'll be seeing things early 2023. With planning on opening our first family hubs by mid-2023. And that is around the need, ensuring that our early years, that our services for our early years, our 0 to 2-year-olds are accessible, are open, are in full partnership, so that all services for 0 to 2-year-olds sit under one umbrella of the Family Hub programme that includes both physical buildings, virtual offers, outreach, and really covers both the local authority, health, voluntary sector, community partners. And we're in the process now of bringing that together. It's going to start off for 0 to 2-year-olds, and we've got funding to cover that early, as we said, that 1,000 critical days for children and young people, but it's going to develop over the years up to the age of 19, so that it's a really true family hub. And we are working within the wider community and neighbourhoods as well to ensure that this is going to be a service that is accessible really for everybody. But the idea is that we're going to reduce inequalities, improve access, improve engagement, because part of the part of family hubs is around engaging and having a parent carer panel that is going to be kind of the where we take our co-production, but we engage and we truly listen to what parents' views are, and kind of moving forward. So that's quite a lot in this presentation. Talks about the legacy of COVID and really moving forward past, you know, the mental health and all the other issues that we've picked up over the last couple of years, particularly for children and young people. So we're really enthusiastic and positive around moving ahead to a really strong early years offer, as well as all the other work that's gone on around social care and education to really bring all these services together and forward. And really happy to answer any questions either about these pieces of work or anything that's in the presentation. So I'm going to now hand over, I think, to Chimame, if that's okay. I think it's in the room.
I am in the room. The only officer. Hello, I'm Chimame Buta. I'm the Public Health Service Manager, and this bit is going to be talking about working adults, living well, and inequalities and the wider determinants. So some of the successes of the past 2 years have been around, as Elizabeth has said, around the fact that we are working with the Institute of Health Equity to become a Marmot Town, and our report is coming out in September with several recommendations across the system, so focusing on local government, focusing on our ICB colleagues, focusing on public sector in general and private sector. So you'll hear more about this as we discuss through the Health Inequalities Board, and we'll try and realise the recommendations and turn them into tangible actions. Of course, the other success that we've had, and you've heard much about this, is the Talk, Listen, Change, which has now become an award-winning piece of research for the year in the university, and lots of papers of research papers have fallen out of that. So, you know, we're pleased that that's happened. And as I said before in previous meetings, we've had an 18-point action plan. And with that action plan, you know, we've managed to be able to get women and girls physical activity off the ground. We've managed to get mental health, in particularly a mental health campaign, just launching off now. We're doing some work around anchor institutions and thinking about racism, discrimination, understanding your patients and your communities, and rolling that out and doing more activities, working with partners and colleagues. In terms of other key successes and the healthy lifestyles, we've got the physical activity strategy and the Let's Get Active campaign, which we ran to engage 30 minutes of physical activity across the town. And then, of course, we've got our housing strategy work, as some of you may have heard about, where we've developed it and we've consulted in it quite deeply. And one of the key successes of that is that we got young people's views and ideas around housing in Luton, what it should be like, what do they think about it, what their experiences are. We are reducing numbers of families who are in temporary accommodation, and that's one of the key successes that we want to continue to build on, and build on home adaptations where people have been seriously impacted from COVID. And one other thing, in terms of the built environment, we have our Healthy Places framework, which you ratified, and we will be coming back to you again as a board to see how we might roll that out and turn that into tangible actions. I know Mark, as our corporate director and chair of the Inequalities Board, will want to see some action around that, and that's one of the things that we'll be looking forward to as we progress the work that we're doing now. Other sort of future things that we are going to focus on is, you know, continue with dealing with the challenges of the pandemic. We're going to definitely look at private rental sector, because we know that's our biggest issue in Luton around housing. And also we're going to roll out the physical activity strategy. It's a whole systems approach, so that's everybody that can be involved has an opportunity to start working, and it touches on so many different areas of health and well-being. And we're going to, of course, work around our cancer work, in particularly the inequalities element around that, tobacco, responding to the Khan review, which is a new piece of a discourse that's come out nationally, and we're going to be looking at how we can be eliminating use within the town, focusing on specific communities. And of course, the national drug strategy, which is coming down nationally, that everybody in England is thinking about. We're going to start building on that. We're waiting for that to come down and drive some of our focus. So that's where we're going in the next 5 years, embedding the Marmot approach across whole systems, working to the Luton 2040 vision, working with the Fairness Task Force, and all the things that you're hearing will definitely come back as a board to you. Hand over.
Sorry.
I'm just going to hand over to Kate because we're doing the live.
Oh, you'll do the last bit.
Thank you very much.
Hello, everybody. Kate Sutherland again, Programme Manager for Integration. I apologise for earlier on only catching the tail end of Mark's conversation. So this is part 2 for me. Just a quick recap. We've covered the new full single point of access that is currently being recruited to in the therapy model, plus the strength and balance training that we are looking to put in place. We've also covered the urgent 2-hour community response and the dementia diagnosis with the intensive support service that's currently being established. So I just got to digital projects. There's a number of digital projects, quite a few across Luton, that are supporting the frail and vulnerable residents. They focus mainly on shared data and supporting early intervention, admission avoidance, and enabling people to stay at home for longer. For example, there's Dockler, which is a digital system otherwise known to yourselves probably as virtual ward at home. And with this system, we can provide early and effective safe discharge to the normal place of residence with clinical monitoring and proactive support in their normal place of residence. I'm happy to circulate any information that anyone wants on the digital projects. There's a number, as you'll see from the slide number 47, a lot of detail there, or happy to come back and present on another day in more detail around those projects. Alongside that, we've also started to implement the Adult Social Care Strategy, and the Adult Social Care Reforms Programme Board and the key work streams are now underway. Chimamie's touched briefly on the cancer inequalities. In regards to ageing well, there's working groups have been established to understand the inequalities across Luton, and we've successfully received funding for Macmillan Cancer Community Connectors, which have now been appointed. The connectors will work with the community to raise awareness of the services and assist with access and understanding of risk. Again, Chimamie's also mentioned cancer in regards to primary care on bowel cancer screening. There's an increased uptake in the screening, which is another climbing success for Luton. So looking forward, next steps, Nikki has also touched on the fuller stocktake recommendations for primary care. So we will be implementing the fuller stocktake and reorientating the health and care system to establish a local population health support. We've also touched on neighbouring teams, which are included in the fuller stocktake, and streamlining access to help people stay healthy and well. Neighbourhood teams also connects into the Place Board programme of work, which the discussion which Mark mentioned earlier, and there'll be a focus on prevention, integrated provision, self-management and access to urgent same-day primary care. Digital projects will continue. There's a number in the pipeline that are looking about community resilience and self-management and support for proactive care to help them keep people at home for longer. We've also got a new mental health strategy working group that is looking to refresh the strategy that is partway developed and address the most pressing mental health needs in the system for the people of Luton. There's much more that I could highlight, and happy to take any questions, or again, if you want more details on the digital there or any other areas, I can come back and present in more detail at another time, but happy to take questions from anyone.
I think I'd just sort of make a comment in the sense that absolutely tremendous, and that is exactly what we need to be doing. So just picking up, for example, for me, we're all part of this new integrated care system and our duty to collaborate. Biggest thing for me is addressing the inequalities, which I think's come out loud and clear. I think the next thing is all what's in, and we've been working on that earlier start and how we work together. The biggest thing I think is the connectivity between health, care, community voluntary sector and our wider community. So I just 100% back it, support it, and it's all about that localism, because nothing will work unless we all work as a town.
Yeah, I agree. There's lots of good work, and I sit on a number of those meetings. So there's a lot of good work with the children early start and the aging well. If I dare address the elephant in the room, I did ask at the Luton Place Board whether we were looking at the Luton Place Board about things specific to Luton, but there are things which are a national issue which also affect Luton, and I'm talking about access to GPs, so getting appointments at GPs, etc. Now, Nina chipped in and said there was stuff going on and things happening in Luton to improve the situation in Luton, and acknowledging that it was still not a very good situation for somebody who wanted a GP appointment. It would be a lot worse if those things weren't happening. I didn't catch from Nina what those things were, and I think it would be useful, because it is still our biggest feedback about getting access to GPs, if we could understand what action is being taken in Luton to improve that situation. Sorry to put you on the spot, Nikki.
No, not at all. And I think, in fairness, I think Pete Reeves on the call as well, is that it isn't just about the individual GP practices in a silo, it's about how we're working together. So just picking up a couple of the items from the Fuller report. I mean, the two big things that come through, and this is the work certainly with Cambridge Community Services and ELF for that matter, is where we've got identified through our risk stratification and the work we're doing to look at really vulnerable people. There is something about what we call proactive anticipatory care. So if we look at people, for example, with, and I'm talking the very complex area, sort of frailty, very, very severe frailty, end of life, serious mental illness, is that they should, with anticipatory care, have a better source of contact than just randomly ringing the GP practice number. So, and I know we have Keach that are on the place board, and she is a real passion that we should be having those, other numbers. What is then very clear, and it's tricky because there were some colleagues here tonight that we talked about at the Overview and Scrutiny Committee, is what is very evident is a lot of our population, particularly the younger population, but it can be all age, if they have an urgent, what I call same day need, they want it done today, which is not unreasonable. So for me, there is something about how we've got connectivity with all our GP practices, whether they want to work through the PCNs and the 111 number, because I can tell you, I've asked residents, I asked the person in the lift as I was walking over here, is that, what would you want? A lot of people don't necessarily want to see Dr. J or Dr. Webby. They just want somebody to be seen. So for me, we've got to get that connectivity with the urgent treatment centres, the GP clinic in front of the L&D, all of those together, so that ideal. And we talked that one good thing that came out of the survey is that our Luton population, if they can't get through to the GP, they actually ring 111 rather than go to the A&E department. So that was a good testament. But the fact of the matter is, if people have got urgent needs, they need to be seen today, and they don't mind where. And I think the challenging thing, and this is where we need some of our clinical colleagues, if you're assessed through the 111 and you're clinically assessed, and you needed an appointment, say, for the next day or the day after, that's the area we've got to co-design together, and that is about managing expectations of patients. And if we've got a continuous shared care record, if the patient was then to decide just to go to the A&E department, we need to be working as a system, and the clinician should have the confidence to say, I see you were clinically assessed 2 hours ago, help me to understand what's changed. And that's, so I think it's it's a complete programme of work, and that's where I've taken the lead. And it's the objective too, and we need to work that through in that place board, because it's not just about the GP practice. However, there are points in that GP survey that we need to address, and we will do.
I would just make the comment that yes, the work for the Bedfordshire Care Alliance on frail and complex needs, for example, should reduce those people that have a high need from going to GPs because of the proactive work. And I'm all for all the proactive work. I think that's true. I think you're right. The absolute thing is about managing people's expectations. I remember 7 years ago sitting in the room on the top floor of the medics surgery thing, saying to Nina, I don't go to my surgery to get cured. I go there for a solution, and my surgery always gives me a solution, whatever that may be. And it is a solution that people want, but it is managing people's expectations. And unfortunately, I think their expectations are being driven by the difficulties they face rather than the communications that we make. And maybe that's where we need to look at how we do that.
Thank you. Nikki, we spoke on Tuesday about this doctor's surgeries, etc., etc. I won't go into that tonight. But I'm looking at the headlines here, and one of them that's the strong, empowered community supporting fairness and equality and local pride. I'm very concerned that as a Caribbean, over the years, I've seen everything has been taken away from the Caribbean community, and basically there's no equality as far as I can see for the Caribbean community. And I won't go into the history, but Hazel, you know me, and you know I've fought for the Caribbean community over the years. And I'm very disappointed that what I've seen, it's like they're trying to wipe the history of the Caribbean community out of this town. And I'm very disappointed with it. It's just a comment.
Particular issue. It's difficult, Gilbert, and it's a specific issue I think you're raising here. Yeah?
You're saying fairness and equality. Where's the fairness and equality for the Caribbean community? That's what I'm trying to get at.
Should I try? I'm not going to try and answer that, but I can just say that in terms of COVID in particularly, we are trying, and we're fortunate. We've got a portfolio holder who does, encourage us to make sure that we tackle those communities that have been most affected. So, of course, Black African, Black Caribbean communities were one of them. So we do try to make sure. So as Mark was saying, with the Health Inequalities Board, received a presentation by the Bedfordshire and Luton Community Foundation, and we're working with them, and we'll continue to work with them to make sure that some of that community support funding, COVID recovery funds, goes into these communities.
Sorry. I mean, I've been on this council 20 years now, and for the last 8 years, I've seen everything taken away from the Caribbean community, and I'm sorry. I've fought for it, and I've lost, and I'm very disappointed.
Anybody else? Katrina, do you want to come in on that?
Yeah, I just wanted to echo what Shememi was saying in terms of, I know on the boards that I sit on and the work that we did with the university around Talk, Listen and Change, we did have the particular community that Gilbert is referring to in terms of the voices there, and we made sure that people from all communities were there around inequalities. I can only talk about health. So I think within that, we've tried really hard with the officers in terms of all communities that were underrepresented or we didn't have, that were affected through COVID, because the work that we've done was through COVID. But we made sure those communities did get funding and did get support in terms of things that are happening and what we have through the pipelines. And like Shememi said, we've made sure that communities from the Caribbean community in particular has been referenced in terms of work that we have done with them. So, we can only say that, we can try and carry on doing the work that we have been doing. I'm not quite sure where you're referring to in terms of things being taken away, but we've made sure that communities that were affected through COVID, and that was one of the communities, along with other communities, and we've made sure that, there has been distribution of funding to go through there and support and work through that.
Look, I'm sorry, I'm not talking about COVID. I'm talking about in general, what was the Caribbean community had over the years. Wellbeing Luncheon Club, daycare centre, etc. It's all been taken away. I'm sorry. That's what I'm on about. The Caribbean community helped build this town. And they have said to me, why have I done what I did? I didn't do it. I tried to stop it. So please, I won't go any further with this conversation.
But thank you. Obviously, if there's anything specific you need to raise, we'll raise. It can be dealt with outside of the meeting, I think, tonight, if you're raising specific issues. If nobody else is on the list, I'd like just to ask, could somebody explain to me what Play Streets activated across Luton is? Because I'm really interested in what that is. If you've mentioned it, I apologise for missing it, but I just want to know what that is.
So play streets are basically where you shut down streets and small areas to allow children to play and roam freely, and you encourage it over a certain time, a couple of hours, and we're just trying to roll that out to enable the built environment to be more walkable, more accessible. But I don't know where they are, but I can find out where they are.
I like the concept of it. I can see a few problems with it, but I like the concept of it. In urban areas in Luton, I can see some problems with that. But the principle of it, I think, is really good. And I think there's a lot of principles in all of this that the detail would be really useful to understand more, because you come and bring the reports and we only see 5 year. For the 5 next years, I'd like to delve more into the detail. So the offers of coming back with more detail on specific areas, I think will be really useful. And I think it would be useful. It's a bit like Phil said about the detail. I think for the Health and Wellbeing Board, it would be really useful to maybe pick some areas and perhaps have one meeting that just looked at that, and then we can contribute to the debate and the discussion and understand it more and see where we might be able to. The Play Streets is one that I think it's a great idea. Making that work might need everybody on side, and therefore working together and members at member level might be really useful to dealing with that. So I'd like to know a little bit more about how and what and when and how. Can we have a think about how we might have a meeting that talks about the detail of the population wellbeing strategy over the next 5 years, perhaps? Do other members think that would be useful? Yeah. Okay. Well, we'll have a look. I'll have a word with Miss Sally afterwards, and we'll see how we can bring that back. If that's all right. Are we happy to go with the acknowledge the strategy tonight anyway? Because we can't agree it because we're not quora, I'm afraid. But we'll see what we can bring back, because I think it's really interesting what you're doing. Okay. I'm afraid we haven't got the report of the Children's Trust Board tonight, so I think that's probably not around. And we're moving on to the Health and Wellbeing Work Programme, which is before you. I don't know whether there's any. Do you need anything from us tonight? Yeah, well, that's on the end. I'll bring it in on the end. Yeah, yeah. This is. Is there any comments on the health and wellbeing work strategy first? No, everybody okay with that, right? Then the last item is the application to consolidate 2 pharmacies. I think this is to inform us and allow opportunity for that to review and provide comments. So, are there comments tonight? Gilbert?
Thank you. I discussed this in health scrutiny on Tuesday. But since it's come to the Wellbeing Board, I thought, now, I've lived in Sunderland Park since 1972. There was 2 surgeries, 10th Avenue and Main Road, Sunderland Park Road. What has happened is that the Alicants gave up the surgery in 10th Avenue. There was father, mother and son used to do that surgery. And eventually it was taken over by the Sunderland Park Road surgery. They still use the 2 properties, 10th Avenue and Sunderland Park Road. Well, because Sunderland Park Road used the smaller pharmacies in general, whereas the 10th Avenue surgery used to use the one in the corner, they're not using the corner one as much. One of the problems is that they want to close the bigger one down in the corner and use the smaller pharmacies. And you can go, whenever I go by there, I see people queuing up outside. Sometimes 10 people queuing up to get into this smaller pharmacies. Now, if you close the one on the corner, which I use over the years, and I used to just phone and says, right, can you reorder my prescription? And they do it. That's the relationship I have with that. Now, that's the bigger pharmacies, but because Sunderland Park has taken over, they use the smaller pharmacies in general. So my fear is that because this is a smaller pharmacies, when that bigger one is closed as well, you're going to get 20 people queuing up outside trying to get in there. I can understand the reason they're doing it, because what's happening in the world today, and it's not as busy as it used to be. But we got to be very careful. As I was health scrutiny the other day, we're talking about doctors' surgeries. Can't get an appointment. 3 days I tried to get an appointment with this doctor. I had to phone 111 for them to get me the appointment. They were talking about cancer earlier. I just thought I might mention this. I had cancer 10 years ago. Right? April this year is 10 years. But what I'm saying is we've got to be careful. We could have elderly people standing out in the cold in the winter trying to get into this it's a much smaller pharmacist. I know the people who actually started the pharmacist there originally, and very nice people. And I can understand the reason, but I don't know if I'm totally going to be happy with it.
I think we're only being asked to comment. What I'm presuming scrutiny, because they were quorate, could send an acknowledgement. We can't do much tonight, I'm afraid. But I'm assuming scrutiny sent some comment.
Could I speak?
Yeah, of course.
Chair.
Yeah.
Thank you. Only because I know a little bit about the background of how this has come to health wellbeing boards. I just thought I'd express that, but I think you're absolutely right because of the quality issue. There may well be a concern. So this is an issue that is very different to GP's surgery closing. If a pharmacy wants to close, they have to consult with health and wellbeing board in order to, as part of their consultation process, along with a number of other, Health Watch is another organisation that they are consulting with. So I think anything that we can submit from Health Wellbeing Board to NHS England will inform on their decision making. So although we can't kind of agree or approve, it's just purely our kind of feeding back, you know, on our views. And obviously as it came into public health, but it needs to come through you. The deadline I think is the 9th of September, which I wonder if there is going to be another meeting before that that's going to allow any kind of response if today's meeting, you know, if you're not able to act on the feedback. Although Councillor did actually, because this also went to the health scrutiny earlier in the week, so his views have actually been taken into account at that meeting. So you know, if there are any additional views, then obviously that might be more problematic, but the councillor's views will be taken into account through the scrutiny meeting.
That's what I thought. If you've made the case at scrutiny, then it will be introduced. It can go. It can go. But we can't send anything
come in here
tonight
for us to then make a decision for the 9th of September, where it's got to go back.
Yeah, it's the 4th. We've got to respond by the 4th.
Because we're not quorum, so we can't.
Yeah, so we can't. But we can find out and make sure something goes from scrutiny. Can we? Yeah, along the lines you've raised. Okay.
Yeah, it needs to come as a letter. It needs to come as a letter from you, Hazel. But we've got all the processes are there. I think all the papers are there. But thank you.
I can't do it. Not if it's come from scrutiny. It'd have to come from the chair of scrutiny.
Okay.
Okay. But did anybody else want to make any comment on it or add to the points that Gilbert's made? No? Oh, yes, please.
Yeah, thanks, Chair. So as chair of the HSCRG, I mean, I wasn't present at Tuesday's meeting, but I assume that the comments that were made then, I will, or someone, the process will be that a letter will be sent in our name or in my name too.
Yeah. Okay, so they'll come in, it would appear. Okay. Okay, I think we're at the end of the agenda tonight. Thank you. Thank you for your attendance. I apologise that we're in quorum. And can I please make a plea that we don't book another health and wellbeing board in August in the future, please? Or indeed in school holidays at all, if we can avoid it. Can that message go back? I realise it's difficult to get everything in the diary and get us all in the diary. I realise that, but it's vital that we have a full attendance here because this is the second meeting where we've been in quorum. So it can't continue like this. So we've got to do something to rejuvenate Health and Wellbeing Board, I fear. Okay? Thank you very much, everybody, for your attendance.